Okay, so how is the coronavirus affecting essential supplies to your homes, Claire?
Well, we have been quite considerably affected. Certainly over the last weeks, we've seen a dramatic fall in the number of food supplies that were coming through. And that reached a point at the end of last week, last Friday, where we were receiving as little as 50% of the orders that we were putting in. So we were quite concerned about that. As a result of that, approached the BBC and wrote a few articles, and it's got to be said, getting information out there, the public support has been overwhelming. We've been approached by a few local suppliers, which has been really, really nice, to say that they're happy to make up the supplies. So these are supplies that we didn't even realise exist, come out of the woodwork, and they said they're happy to work with us. And also the supplier that we worked with, when we were sort of explaining to them, they've worked hard to top it up. So this week hasn't been too bad. Which has been really heartening. Our long-term concerns are none of us have an idea how long this is going to go on for. So we're unsure as to whether this, what we've seen returning back to normal supplies will last. There are still some things that are missing off, like the rest of the world. We seem to be struggling for toilet rolls. So in one of our homes that supports 50 older people and people with dementia, we get through quite a few toilet rolls there, and so our normal order is quite considerable. And when you're being told that actually that's left off this week's list, that's kind of concerning. But again, it's got to be said, we've rallied locally, we've spoken locally to individual suppliers, and people have rallied round. And what's been incredibly heartening is that even though we certainly don't look for charity from the families of the individuals we support, families themselves have come forward and said, are you okay? Is there anything we can do to help? So we're okay at the moment, but we're watching it very carefully because, like I say, none of us know. It's a week by week, Well, actually, we get 3 deliveries a week, and every time the delivery comes, we wait with bated breath to see what's going to come through.
So you've been asking for donations, and you've been getting those from the local community as well?
We have. Well, we've gone out because a couple of articles have gone out in the press, and so we found that local suppliers have come to us and said if there's anything that we can do to help. And as a result of that, what we're going to do moving forward, we're going to review all of our supply chains and look how we can support the more local suppliers and go to them and use them more proactively moving forward afterwards, because some of them we didn't even realise existed. They've come forward and offered their support, and in response to that we're going to see, well, moving forward, how we can work with them, because we'd much rather work with local suppliers anyway.
So it's food that's the main issue has been so far. What about medical equipment, those sorts of things?
There's like I say, there's food, toilet or cleaning products have been a challenge. We've been, from a medication perspective, at the moment, we've not had any shortages of medication, but we have been told that there can't be any guarantees that medication will come through. We've had to build in business contingency plans and speak to a number of pharmacies to make sure that we've got backup. So if at one point our delivery comes in and we haven't got the appropriate amount of what we need, then we can go to another pharmacist. So we've had to build in rigid business contingency to make sure we're covered with that regard. One of the concerns is, because of the changes with regard to us having visitors in and people coming and delivering, the medications are being, like, they're doorstepped, so they're left on the doorstep, and then the person goes back. So we're not going through and signing them in the same ways that we would be. So they're being delivered, we're then seeing them, and then we're doing the remote check, and then if there's nothing there, it then takes us time because we have to go back to them to say, well, actually this wasn't there. I mean, I should say that they don't just drive off and leave them there. They make sure that we pick them up. But ordinarily, the person would come in, we'd go through it together, our medication manager would go through piece by piece and make sure that everything is there. But obviously, if something's being dropped outside, and then the person is checking to say, right, yes, you picked the box up and you're going inside, then it's only when we're inside that we can check what we've got. And so that means that if there's nothing there, it's another palaver. I have to go back to say, actually, something's missing and something. So that's one of the issues. But at the moment, to be fair, we have had everything coming in. It's slightly different with regards to the PPE. we have struggled to get supplies through with that, but certainly the other food and medication we're managing through ongoing communication to keep on top of that at the moment.
Yeah. So how are you handling the PPE? Is that something that do you know how to get fresh supplies, and that those are coming through when you order them?
Well, we do. Well, with regard to PPE, we're the local authority's been incredibly supportive, and they've come and they've given us stuff when we can. The trouble is that the shortage of equipment coming out. So we're okay for hand gloves, but aprons and masks, we're already showing signs that because the amount that you would need to use would extend. Because the difficulty is, and this is exactly the same in all residential care homes, is you get the supplies, but you use the supplies. So we are already, this isn't new to us. We are used to using PPE. Granted, we don't use the masks as much as we would do if we had somebody who was infected, but we are used to using PPE. And so you get a delivery and you're using it, and you have to change your gloves and apron after every episode that you do of support. So we might get a delivery. It doesn't just sit there on the side and wait until we hear that, if anybody's infected. We're using them anyway. And the concern is we're gradually seeing the supplies dwindle. Yeah. And we are getting to that point now that getting the high quality PPE is difficult. So for example, the masks that we should be using, the high quality ones are the FFP2 ones, but they're the ones that everybody is saying that they're really struggling to get. So we're all in the same boat of having to go out, because the last thing you want is a staff member, out of the goodness of their heart, seeing a mask on eBay, saying, oh, I saw some and I've delivered some, but actually they're not right. They're not at the right spec that we would want them to be. Yeah. So everybody has to make sure that not only are you getting this equipment in, but it's to the right spec. So it's got the right certification on to say that it's at the right level, because there's no point having a mask if it's got gaps on the side and it's not the full proper face mask. Yeah. So that's the trouble, that everybody's after the high spec ones, and these aren't always the ones that people are finding and people are able to source. Right. So this is where we're struggling with some of our homes, making sure that we are getting the right supplies in. We've heard from the government that the military are being involved and delivering to NHS, but we need to make sure that extends to social care as well, because I haven't seen evidence at the moment. I might be wrong, it might be somewhere that I'm not aware of, but certainly I haven't seen evidence that these supplies that are being delivered by the military are extending to social care.
So you'd like to see that sort of delivery in terms of PPEs, the military getting involved in that sort of thing?
Well, I absolutely think that, of course, our NHS colleagues need to be the first in line to get that. I wholly agree with that as a strategy. However, social care can't be ignored. We haven't got anybody that's got the virus. We haven't had anybody that's shown the symptoms of the virus in any of our Cintre residential homes. However, the minute that somebody does, they're going to be staying with us. They will be obviously put into isolation, but our staff will have to support them. So in exactly the same way as if they were being supported in hospital, our staff will have to continue to support them. So it's essential that we have the appropriate PPE there in the same way that the NHS has the PPE there. Yeah.
And how are you monitoring your staff and residents for any signs of the virus?
Well, the residents, because we work with the district nurses, and we obviously, from their medication, we make sure we monitor their health continually anyway. So we're making sure that, so we always monitor their health. We make sure that their temperature, whether anybody's demonstrating any cold-like symptoms, but we would be doing that anyway. So when we're doing the medication and we're filling out the MAR sheets, we always monitor. So that's, if people have medication 3 times a day, that's 3 times a day they're being checked. So we're rigorously monitoring them anyway. With regard to the staff, we are having to be absolutely rigorous about what we're doing. we are saying if anybody has any suspicion, even if you're on the borderline with the temperature, I know that people are saying, well, we're really struggling to get thermometers at home, but the main thing is if you're feeling hot on your chest and on your back, don't just sort of feel your head, but actually if you feel that you're burning up on your chest and your back, if you have any shadow of doubt, don't come in. If you have any cold-like symptoms, don't come in. If you have any members of your family that are demonstrating that they're presenting with these symptoms, then don't come in. And we're being incredibly sympathetic to them, saying that please do not put the residents at risk by coming in. Obviously contact your GP, but we'd rather be safe than sorry, in the same way that if anybody's coming back from travelling abroad, and we have had staff that were abroad at the time when this came out, and then they've travelled back. So even if they're not presenting any symptoms, we're saying stay at home and self-isolate for 14 days, because it's just absolutely not worth it. And our staff are incredibly rigorous. They know the importance of that anyway. They're used to, all staff that work with vulnerable individuals in residential homes are very used to monitoring how they feel and how that comes in. They know that if they have any other symptoms like an upset stomach, they know to not come in for 48 hours. So this is something that we're used to, but the staff are being very, very sensible. But it's also worth saying that we have, over the last 2 weeks, well, over 2 weeks now, we've introduced a temporary ban on all visitors coming into the home. So before we had the announcement on Monday evening, that 2 weeks before that, we actually made our own call not to bring visitors in, because it was harder to monitor what they were bringing in, which was difficult because predominantly these were family members that were coming in. So that means that you are telling family members that they can't come and visit their relations. Some of the family members, if I think about one of the home that we support older people and people with dementia, then some of them are husbands and wives, and they come in every day to visit their family members. So having to tell them that they can't come in is a hard job to do, but they do appreciate that it's, that there's absolutely not worth taking the risk. And since obviously the government has introduced the stricter guidelines, then we've just adhered to that, in exactly the same way with any contractors, unless they're emergency contractors coming in, which we need to do for the safety of the home, and then we have very strict procedures that they follow, and we have specific areas that they use, and they do not come into contact with the residents. Our entertainments that come in externally have been stopped, any hairdressers that come in, but that does mean that that's been an extra pressure on the staff, because they have to make up for the fact that none of our residents can go out to activities. They're not having external people coming in to do the activities or doing their hair. So they've had to provide activities internally. And I must say, as all care and support workers, they've turned their hand to this beautifully, and they've done some wonderful activities inside. So last Sunday, when it was Mother's Day, they made sure that everybody felt pampered, and were doing sort of, doing hair and putting rollers in and doing manicures, making sure that people were able to speak to their families on the telephone and have that face to face. Where people have got the capacity and got the technical know-how, to be frank, they've WhatsApped their family and done FaceTime with their family. We have closed Facebook set up, so we can put up lots of photographs so people can keep in touch, and that's really important for the well-being and mental health of the families and the residents that we support.
I guess I presume that getting the government to roll out testing more widely would be very welcome as well.
Sorry, pardon, I didn't hear you. What did you say, Lee?
Getting the testing of staff and residents, how important is that for you as an issue as well in terms of the virus? Yeah,
well, I'm really pleased with that. I mean, that's absolutely essential. If we knew that, because it is a very difficult scenario at the moment, that we don't know, none of the residents are tested, and it could be when there's staff shortages that when we're saying to somebody who's travelling back from somewhere, demonstrating absolutely no symptoms at all, that they have to stay at home for 14 days, that's really, really difficult, because if they were able to be tested, we'd be able to know, and they'd be able to be back in. So that would be fantastic. With regard to the residents, if we've got somebody, and remember the time of year, I mean, it is that, you know, people get, you know, we get sort of colds and sniffles and everything because it's that strange time, like today it's warm, tomorrow it's meant to be cold. So people demonstrating cold-like symptoms and sniffles that are likely to lead to a temperature and likely to lead to a cough. You know, it might be that people are, you know, we can't take the risk of saying, well, we want to wait until somebody's developing full-blown symptoms. As soon as somebody is beginning to develop one of those symptoms, we want to isolate them, because we, you know, certainly at the moment, we're thinking that, you know, before people demonstrate the symptoms, they're not contagious. But if people begin to demonstrate them, as soon as they do, they are contagious. And even that, the, you know, the knowledge around that is changing daily. But if somebody is presenting the slightest symptom, we have to self-isolate. And it's such a shame. Imagine to keep somebody in their room for 14 days when actually they've just got a slight cold or a bit of a temperature.
Yeah.
You know, that's really, really frustrating. Whereas if we were able to test, and we don't know, because we don't want any of us to be carriers. I mean, if I use myself as an example, I mean, I'm going into all of these residential homes to work and to support because I need to, as all of my colleagues who are having to go into the homes, you know, just having those tests would make a considerable difference.
Yeah, I know it's obviously a very challenging time for you, but I guess looking ahead, you think you can manage this situation, and you will get over this obviously eventually, and things will start to improve.
Yes, absolutely. And I mean, the really positive thing that's come out of this, which we've been thrilled about, is, first of all, our teams have been absolutely wonderful. And I'm sure other colleagues in other homes have seen the same, that the teams have absolutely stepped up, considering they're right on the front line. They've really stepped up and been incredible. And so that keeps us the momentum to get going. The support that we've received from the local authorities and CQC has been absolutely commendable. They've really stepped up and are sending out regular updates, sometimes a couple a day, certainly every other day we're receiving information, and they're saying we are on the end of the phone if we need support. Skills for Care have set up a task group looking at anybody's concerns, sharing, looking at forums to set up. Care and Support West have done something very similar. So we will get through this, but while we're getting through this, we're feeling incredibly well supported. And the great thing is, this has forced us to be creative in the ways in which we're interacting with each other as colleagues, and bringing us far closer, and we're all uniting. So there are some positive things, and yes, we definitely will get through this no matter how long it takes, and I think we'll all come out stronger and more collaborative at the other end.
That's great, Claire. Thanks for your time today, and wishing you all the best with dealing with this trying time.